Welcome to my medicine class. Uh, Actually, in the last few years, the medicine questions are now very high. Not only the core medicine, but also the clinical aspect of the other subject like clinical physiology, clinical pathology, clinical pharmacology, clinical microbiology. And if we consider this whole as a medicine, the number is almost 40 to 45% now. So medicine is a very important subject nowadays, and it's always been, because the degree is also always Bachelor of Medicine and Bachelor of Surgery, whatever. But in my country, to be very honest, the content available for medicine is very vast. And for the student like us who cannot study 12 to 14 hours or 15 hours a day for 6 to 8 months continuous, we are not unable to do that basically because we have some many other distraction or all. So it's very difficult to grab the subject and to have a brilliant concept and to solve all the MCQs because the content is huge, content is very vast. So that's why I am trying to start this medicine class where I will make this content very short, very crisp, yet it will be very conceptual and we will solve all the MCQs from that. I am teaching now for the last 10 years, but the only problem you will face is my language. Because I am teaching now 10 years, but this is in my mother tongue Bengali. So my English is not as good as others, but I can guarantee you, if you break this language barrier somehow and connect with me, connect with my this little lower level of English, you will be profitable. And I can also assure you, if you continue to take these classes, my English will improve in the next 2 months. So with my limited vocabulary, I can't talk much. So let's straight go to our topic for the today. Today's topic, that is ARDS and respiratory failure. I'm sorry for my language, but it's not as good as my mother tongue. If I am giving opportunity to take the class in Bengali, then I will show what can I do. But yes, I can also do it in English, but it will take 2 months. But before that also, today's class will be the shortest class of this topic and you will able to solve all the MCQs after this class. So today's topic is two. One is ARDS, that is also always written, and second is respiratory failure. Fine. So what is ARDS? ARDS. So you already know this is our alveoli, and below our alveoli there is pulmonary vasculature. There is pulmonary capillary and all, and here the diffusion of gases happen. So oxygen is entering inside the bloodstream and carbon dioxide is getting out. So this is our diffusion, and this is our diffusion membrane. So there are many layers, like first layer is surfactant layer, second is alveolar epithelial layer, third layer is the basement membrane, fourth layer is the interstitium, fifth layer is the basement membrane of the endothelium, and the sixth layer is endothelial layer. So there are 6 layers in the diffusion membrane: surfactant, epithelial layer of alveolar epithelial layer, alveolar basement membrane, interstitium, endothelial basement membrane, endothelium. So these are the 6 layers, and through this layer this diffusion is happening. This is the normal physiology. What is the ARDS? When the fluid from the blood vessel, the pulmonary blood vessel, the fluid releases and fill the alveoli. So what is happening in ARDS? There is basically accumulation of fluid inside the alveolus. So you can easily guess the diffusion will hamper. The diffusion will not happen. So in ARDS, the alveolus is filled with fluid. And what is this known as? Yes, this is known as pulmonary edema. So ARDS, pulmonary edema is happening. So from the pulmonary vasculature, fluid is coming out and it fills the alveolar. But what is the most common cause of pulmonary edema? Yes, this is heart failure. Because in heart failure there is congestion, there is backflow of the blood in the pulmonary vasculature, there is pulmonary edema. But in ARDS there is a difference. In ARDS there is pulmonary edema, that is correct. Similar thing like heart failure, but this is non-cardiogenic. This is non-cardiogenic. So that is the major difference in ARDS. So what is ARDS? this is a non-cardiogenic pulmonary edema. Matlab, pulmonary edema is happening, but this is not due to a heart cause. So first of all, what are the causes then? So what is the etiology of ARDS? So we can divide into a direct lung cause or an indirect cause. Indirect means where the lungs is directly involved, like a pneumonia. An infection is happening in the alveoli, there is inflammation, there is pulmonary vasodilation and pulmonary permeability increases, there is edema. So pneumonia. Or like any aspiration or any drowning, this type of thing. Indirectly, what is the most common cause of ARDS? That is always sepsis. Why sepsis or any this type of infection causing ARDS? I will come to that, but any sepsis may lead to ARDS, like pancreatitis. Because pancreatitis also cause SIRS, systemic inflammatory response syndrome. Acute pancreatitis leads to sepsis. Next, any trauma. So this type of thing can cause ARDS. So there are directly lung cause or some indirect lung cause. So that can cause ARDS. Now what is happening in ARDS? Why there is pulmonary edema? What is happening? So basically there are inflammation. So what is happening? Ultimately there is some inflammation. And whenever there is inflammation, there are few markers that is released. What are the markers of inflammation? Interleukin 1, interleukin 6 and TNF alpha. So these inflammatory markers comes. And इसके बाद क्या होता है? What happens after that? What happens after that? There is always this type of thing. Always what they does? They increases the pulmonary vessel permeability. So permeability is increasing of the pulmonary vasculature, and as the permeability increases, there is pulmonary edema. So that is the mechanism of ARDS. There is inflammation, there is permeability is increased, and there is pulmonary edema, and this is a non-cardiogenic cause. That is not due to heart failure. So how can we differentiate? That I will come to later in the investigation part. But here this is pulmonary edema is happening by this inflammation. So if all the alveoli are now getting filled and diffusion is not happening, so there is an option, you can die straight now. You can die right here. There is a full of pulmonary edema, all the alveoli are collapsed, there is no oxygenation, no diffusion, and you die. But if you survive, then there is a sequelae. So if I can say, if ARDS में होता क्या है, what are the things that can happen in ARDS? So first, there is inflammation. Then there is pulmonary edema. And if the patient survives, then come the fibroblast coming in the scene, and fibroblast proliferation is happening, and ultimately there is a fibrosis. So ultimately there is a fibrosis. So in COVID time, we also heard about this, because in COVID, what is COVID क्या करता है? So COVID is basically doing ARDS. So if the patient died in COVID, if the patient survived, then COVID leads to lung fibrosis. That is a post-COVID sequelae or long COVID syndrome, where there is a lung fibrosis is happening, and that is the reason why the lung fibrosis is happening, because if the ARDS patient survives, there is a chance of fibrosis. So these are the events that is happening in the ARDS. So what are the clinical features? Obviously in the clinical feature, as the diffusion is not happening, so obviously there will be very much hypoxia, or that leads to breathlessness, leads to tachypnea, even leads to shock. So this type of thing may happen in the ARDS. This is not very important, this will not ask you, but what they will ask is the investigation. So how I can diagnose whether this is an ARDS or not? So first of all, I have already told you that this pulmonary edema it may be due to cardiogenic cause or may be due to ARDS. So I have already told you. So first you have to differentiate whether this is a cardiogenic or a ARDS. So by which I can think it's a cardiogenic or a non-cardiogenic. So if it's a heart failure, if it's a left heart failure, so must be their left atrial pressure will be high. And by which measurement we measure the left atrial pressure? Yes, it's pulmonary capillary wedge pressure. So if it is a cardiogenic cause, then the pulmonary capillary wedge pressure is always more than 18. But if it is ARDS, then it will be less than 18. So that is a major difference. So there may be pulmonary edema, but first I have to think whether this is a cardiogenic cause or a non-cardiogenic cause. And if this is PCWP is less than 18, then that is ARDS. What are the other investigation I can do? Obviously, we can do a X-ray or a HRCT. We can do anything, and ultimately, what we get? We get a whiteout lung. We get a whiteout lung. There is a bilateral infiltrate. So this type of thing we can get. But what they ask you in the exam is the diagnostic criteria of ARDS. And what is the diagnostic criteria of ARDS? That is your Berlin criteria. That is your Berlin criteria. And Berlin criteria rotates around the concept of PaO2 by FiO2 ratio. I am sure many of you do not know what is PaO2 and FiO2. PaO2 means the arterial pressure of the, it's the partial pressure of oxygen in the artery. So this is my alveoli, and from there the blood vessel takes the oxygen to the tissue. So blood vessel takes the oxygen diffusion is happening here, and oxygen is going to the tissue. So there is a partial pressure of oxygen. There is a partial pressure of oxygen, and that is known as PaO2. That is known as PaO2. And what is FiO2? FiO2 is the oxygen that is delivered to you. So the oxygen that is delivered to you is FiO2, and oxygen partial pressure in the artery is known as PaO2. That means right now I am taking oxygen from the atmosphere. So in atmosphere there is 20% oxygen. So now FiO2 is 20%. So at now, if I am saying, suppose now I am taking FiO2 from the atmosphere. So FiO2 is 20%. That means 0.5, 20 by 100. Sorry, 20 by 100 means 0.2. That is my FiO2. And suppose right now my PaO2 is 100. Suppose 100, because it is vary from 70 to 100, but let's suppose my PaO2 right now, my partial pressure of oxygen in my artery is 100. So what is my PaO2 by FiO2 ratio right now? So my ratio is right now is, it is now 500. So that is my PaO2 by FiO2 ratio. Now you can obviously understanding from this area, in ARDS what is happening. So in ARDS there is fluid collection in the alveoli. So obviously there will be less diffusion. So whatever FiO2 you can give, the PaO2 will not increase. So that means PaO2 is always less in case of ARDS. So Berlin criteria क्या बोलता है? What the Berlin criteria says, that is, if the PaO2 by FiO2 ratio, it is between 200 to 300, that means this is the mild ARDS. If it is between 100 to 200, then it is a moderate ARDS. And if it is less than 100, then it's a severe ARDS. So as the ratio decreases, the severity of ARDS is more, because as less mean what? Less mean PaO2 is less. So whatever FiO2 you are giving, you may be giving 100% oxygen by a ventilator or something, but still PaO2 is not increasing. So the ratio is decreasing continuously, and in severe ARDS, this is less than 100. So what are the management you can give? What are the management you can give? What are the management you can give? The only management you can give is ventilation, because oxygenation is not happening. So you have to ventilate the lung. That is the only thing. But as the lung is already very much tired, lung is already very much diseased, you cannot give high flow oxygen. So that's why in management we give low tidal volume but high PEEP ventilation. And as there is a ventilation perfusion mismatch because diffusion is not happening, so we also use prone ventilation. Because whenever we do proning, we ulta kar dete hai patient ko. Whenever we do proning, the ventilation perfusion getting better due to gravity. So prone we can do, and as there is a low tidal volume to avoid barotrauma, so basically we are giving less oxygen to avoid barotrauma. So there is carbon dioxide level is little more. So that is known as permissive hypercapnia. So in this type of ventilation, we are allowing a little bit more carbon dioxide. So we are allowing permissive hypercapnia. So that is the management of ARDS. Now a simple question may be asked to you, in ARDS, which type of respiratory failure is happening? So which type of respiratory failure is happening? So there is the alveoli, there is a blood vasculature, and there is a fluid accumulated in the alveoli. Fine. So basically diffusion is not happening. So whenever there is diffusion problem, we get low oxygen but we get normal carbon dioxide. Now you may ask me, if there is a diffusion problem, oxygen will not also enter and carbon dioxide will not also go out, because diffusion is happening both the gases. So only why oxygen? Because from the class 11 knowledge, from the NCERT class 11, you should know the diffusion power of carbon dioxide is much more than oxygen. So oxygen is not able to diffusing from this fluid filled alveoli, but carbon dioxide power is much more. So carbon dioxide may diffuse. So that's why in diffusion problem, the oxygen will be less but carbon dioxide is normal, and that is always happen in this type of diffusion problem like ILD or ARDS. So ARDS is basically a type 1 respiratory failure. So this is the type 1 respiratory failure. What is the type 2? In type 2 there is a ventilation problem. So you cannot ventilate. So if I cannot ventilate, that means I cannot also taking oxygen, and I am unable to exhale the carbon dioxide because my ventilation is impaired. So oxygen is not also entering and carbon dioxide is not exhaling. So in type 2 respiratory failure, I get less oxygen and increased carbon dioxide. And where I can get this? Any muscle paralysis where my ventilation is affected, like myasthenia gravis, or any skeletal abnormality like kyphoscoliosis, like this type of thing, where there is a muscle paralysis and this type of thing, where I cannot ventilate, we get a type 2 respiratory failure. And what is the type 4? Type 4 is when your respiratory muscle not getting oxygen. So your respiratory muscle, your diaphragms are not getting oxygen. Why? Why respiratory muscles are not getting oxygen? Yes, you are in shock. So obviously you are in shock. That's why your muscles are not getting oxygen. So they are not contracting. So ultimately your ventilation is impaired. But when the ventilation is impaired due to other causes, we can say it's a type 2. But when the respiratory muscle is not working due to hypoperfusion or due to shock, this is known as type 4 respiratory failure. But in ARDS, we get a type 1 because this is the diffusion problem and carbon dioxide is normal because the power of diffusion of carbon dioxide is more than oxygen. So with this, we have finished this topic, ARDS and respiratory failure, and I can assure you can solve all the MCQs from this topic. So ARDS means pulmonary edema, but that is a non-cardiogenic cause. We rule out by checking the PCWP, because if it's the cardiogenic cause, then PCWP will be more. Now, what are the causes? Maybe direct lung cause, maybe indirect lung cause like sepsis or any trauma like thing. And then What is the main thing? Main thing is the Berlin criteria, the mild, the moderate and the severe, PaO2 by FiO2 ratio. And in the management we give low tidal volume, high PEEP ventilation, prone ventilation, and we allow hypercapnia, permissive hypercapnia. So, and this is a type 1 respiratory failure. I hope in a very short time with my very poor English, I can make you understand this topic, and I can assure you this channel, if I continue to take this class, and my English will automatically improve if I am going to take the classes, there is no problem. This will be the channel for the future. Thank you. This is a manifestation.